something of that nature, now's your chance to go ahead and log off. But we are recording, and again, welcome to our Lunch and Learn webinar on public health, more than epidemiology, the many facets of public health. Thanks for joining us this morning. I am Tim Panfill, the Senior Director of Graduate Admission and Enrollment Management for Elmhurst University. And it's my pleasure to be the moderator for the webinar. Joining me this morning is Sherry Vaccaro. Sherry is our Assistant Director of Graduate Admission, and she's our specialist in terms of our graduate programs in healthcare. So if you have questions at the conclusion of the webinar about the public health program at Elmhurst University or any of the other programs we have in the healthcare area, please do reach out to Sherry. There's her email as well as her phone number, and we'll probably pop that into the chat in just a moment or so. I encourage you to be putting your questions into the chat box. We will do our best to address those questions as we go throughout the presentation. And of course, we will leave time at the end for a general Q&A session. It's now my pleasure to introduce our keynote speaker, Dr. Molly Tran. Dr. Tran heads up both the undergraduate and graduate programs in public health at Elmhurst University. I think one of the unique things that Molly brings to Elmhurst University is that not only is she a skilled professional in the field of public health, she's also a medical doctor. So I'm going to go ahead and let Molly introduce herself.
All right, thank you, Tim. So as Tim said, I'm Molly Tran. I am the Director of the Public Health Programs here at Elmhurst University. My own background is that I was originally trained as a doctor and worked in the field of occupational and environmental medicine. And a few years back, for some of the reasons that we'll actually probably get to as we're talking about the differences between medicine and public health, decided to switch over to the public health world. I've been a public health faculty member for about 5 years now. And 2 years ago came to Elmhurst University, was very fortunate to come to Elmhurst University and take over directing the Masters of Public Health program and starting our new undergraduate public health major and our 5-year combined undergraduate major and Masters in Public Health degree at Elmhurst, and getting to shape those and getting to start our new concentration in leadership and innovation in public health. So that's a little about me.
Great, and Elmhurst is very lucky to have you as a faculty member here, Molly. So let's start at the very beginning. Could you provide a general definition of public health?
Yeah. So if you look up the definition of public health, you'll probably find a definition that talks about basically it's the study of the health of populations. That's how it's usually defined. I don't love that definition because I think as someone who is maybe looking into public health, isn't doing public health yet, like what is the health of the population? What does that mean? So I like to define it as basically health in context. So we deal with basically all the things that determine your health and sort of the choices that even, you can make about your health that don't happen sort of in a doctor's office or a clinic. And I'm going to share one of the 2 slides I have to share. I promise not too many slides. But we call those things the social determinants of health. So that's things like education access and quality, healthcare access and quality, your neighborhood and the built environment and how that's laid out, and can you walk? Are there safe places? Social and community context, that includes things like the social capital and how close-knit your community is, but also things like racial discrimination and other forms of structural discrimination. And then economic stability, and that includes things like, your stable access to housing and to healthy food and to things like that. So those sort of elements, those social determinants of health altogether are actually estimated to account for about 80% of healthcare costs beyond, sort of what we do, in a hospital or a clinic. And that's what we really focus on in public health. The other thing that we really get to focus on in public health, and why I really love public health, and one of the reasons I switched from medicine, is that we really get to work to do prevention. So rather than sort of treating disease after it's already happened, we get to prevent disease or injury, and promote health, and really make a big difference that way. The sort of the basic disciplines of public health, the basic sort of areas of public health that you might hear about are things like epidemiology, biostatistics, community health, health policy, occupational and environmental health. So it's a broad field, but basically our main focus is sort of that health in context and how do we prevent disease and promote health.
Yeah, and I think that when most people, myself included, think of public health, we think of epidemiology. Particularly in the last couple of years, obviously with the COVID-19 pandemic. But from the chart you shared, I mean, there are many other aspects that are affected by the field of public health. So another question we often get in the admission office is how does it differ? And maybe you can get in more specifics from like nursing and medicine.
Yeah. So, okay, so understand that everything I'm saying, there's a Venn diagram with a whole lot of overlap, increasingly, and that's great. So increasingly, a lot of people in healthcare are paying attention to public health and paying attention to the social determinants of health. So, you know, it's not a like clear delineation. Of course, the biggest difference between, you know, like nursing and medicine and those sort of healthcare disciplines is that you're generally providing one-on-one patient care, right? Where we interact with people in many other ways, but we're not usually treating individuals. The other thing, and the other big difference is that most of what you do in healthcare is, you know, treating a disease after it's already taken hold. You do some preventive care, right? You do your you know screening exams and your vaccines and things, but a lot of it is medicating and you know treating injuries and things like that. Again, with public health, we get to actually take that step back and you know stop the stream, right? Go upstream and stop the stream of injuries and illnesses from happening. So we really have a focus on prevention, and that is the other slide I'm going to share real quick. You're getting like the you're getting the really quick tour of the most important stuff that we do in public health. But when we're thinking about how to impact health, from a public health perspective, we talk about this health impact pyramid. And just to give you the really quick overview of it, you know, at the top you have things like counseling and education, then clinical interventions, right? So that's things that like doctors and nurses are doing. You have sort of long-lasting protective interventions. That's things like vaccines, right? You do it once and it lasts a long time. Then you have things like changing the context to make sort of default decisions healthier. So that's things like changing social norms and changing the built environment, things like that. And then socioeconomic factors, which of course we can imagine have a lot to do with your ability to access healthcare and healthy food and healthy housing and a good environment and all that. And if you look at the arrows here, we have sort of on one side, right? As you go down that pyramid, you get more impact for what you do, right? So if you're counseling and doing education one-on-one, obviously you're having a great impact on that one person, but it's one at a time, one at a time, one at a time. If you're changing the entire, cleaning up the entire water supply for a community, no one individual had to do anything, but all of a sudden that whole community is healthier. So when we're working in public health, we really try our best to be, on those sort of three more base levels, the purple and the blue and the orange levels of the pyramid, whereas doctors and nurses are doing the very essential work that's more at the top of the pyramid. So that's really what we focus on again, and that's how we get that sort of big bang for our buck in prevention, is by making those more systemic and those more structural changes. And then we complement, healthcare workers who are doing, the day-to-day care that needs to be done for folks who already, need healthcare and to keep people healthy. And obviously, it's also, there's not a fine line, and it's a great mix. So lots and lots of folks who are in healthcare now are getting their masters of public health or getting their public health degree. Because it makes a lot of sense to have that, knowledge, and people are starting to really realize that, like, healthcare alone isn't going to fix our problems. So we need to pay attention to the social determinants.
I remember seeing a quote from one of your alums from the program written about a year ago in our university magazine, Prospect. And I remember that she indicated that when she was an undergraduate student, she was kind of on a pre-med career path, but she ended up pursuing the MPH program here because she wanted to affect a wider population of people, because if you're a nursing or you're a medical doctor, again, you're affecting a smaller group of individuals. And her goal was to try to make the biggest impact that she could with her career. And that's what really got me starting to think about, there's a lot of other aspects of public health than just this controlling the spread of infectious diseases. What are some of the current issues that we in the US are dealing with in terms of public health outside of epidemiology?
Yeah, so it's funny, because of what, 3 years ago, two years ago and 2 months ago, we didn't think, I think, about public health nearly as much about infectious disease as we do now. Right now, everyone thinks public health and they immediately think COVID and controlling infectious diseases, which has a long history in public health. It's, really was what it was founded on. But for many years prior to COVID, what we were really focused on was things like controlling chronic disease, right? So that's things like cancers and heart disease and heart attacks and all those sort of things that are in our top 10 CDC's top 10 list of mortality and what makes people sick in the United States. So we were really focused on physical activity and nutrition and and all those things to prevent those diseases. Obviously, another thing that was really, I think, at the forefront much more pre-COVID and now is coming back is the opioid epidemic and sort of the twin epidemic of mental health issues, which existed and was a problem pre-COVID and has gotten worse since COVID. Other things, it's not just illness, right? So injury and violence and both gun violence and things like traffic violence, people dying in car crashes or pedestrian, injuries and deaths are skyrocketing. And that's one that I think people don't think about a lot, but it's actually basically the number one cause of death for Americans from age 1 till about 45 is injuries. And the number one cause of those injuries is automobile crashes, either being in a car or being a pedestrian or being on a bike. So that's something that, like, again, we have to make those sort of built environment changes to fix. Climate change, again, was sort of more on people's minds and is returning people's minds because that's going to have a lot of health impacts. That's going to impact, more natural disasters and planning for health in the immediate aftermath of that and planning for resiliency, before natural disasters. That's going to affect the health of workers, that's my old field, and people who work outside and, how the heat and how long they can be, working safely. And it's going to, not to bring it back to infectious disease, but it will, impact sort of the sort of distribution and geographic spread of where, things like what we call vector-borne illnesses, things that like mosquitoes and other, biting insects spread. So we'll see, things like dengue and malaria in places that we didn't see it before. So, whether you're interested in sort of the health of the environment, the health of, sort of preventing diseases or preventing injuries, there's a lot of work to do.
I want to remind our guests today to go ahead, and if you do have a question for Dr. Tran, to enter it into the chat, and we'll be addressing them throughout the Lunch and Learn today, as well as saving some time at the end for just general Q&A. We're going to talk about different types of careers and positions within the public health field. But before we get into that, I want to go back, and you mentioned mental health. And we're hearing more and more in the news that we really have a mental health crisis that has been exacerbated by COVID and the lockdowns and the social distancing and the wearing of the face coverings. I believe the U.S. Surgeon General a few months ago declared it, a national health crisis. Here at Elmhurst University and at college universities across the country, we are seeing an increased number of students that need services, that need some counseling services. So can you talk a little bit about what we're seeing, in the teens and 20 somethings? And then I know we do have a video clip that we'd like to share as well.
Yeah, so as you said, that's something that's really, I think, being talked about a lot more recently, and particularly in the university or the college setting. That's something actually that I'm teaching a class this semester called the Leadership and Innovation in Public Health Seminar for our upper level undergrads and our master's students. And we're doing a design sprint project, basically looking at that problem, looking at, sort of how do we improve college student mental health? How do we address that? But yeah, it's very clearly on the rise. It was, things like depression and anxiety among college students were already on the rise before COVID, but have gotten worse. So, in 2020, they did a national study and they found that nearly 40% of college students experienced depression, about 1 in 3 reported having anxiety, and both of those rates are double from 10 years ago. So it's an issue. The reasons behind that, I think no one knows exactly, can exactly tell us the reasons. Some of it, I want to be careful to say some of that may be good in the sense that people are, college students coming out now feel less stigma about talking about mental health, about reporting, that they're feeling depression or anxiety and seeking care for it. So some of that may just be, people feeling more comfortable actually seeking care, and that's a good thing. Some of it may, college already is a time of a lot of transition, a lot of change. Maybe people are away from their families for the first time. They are figuring out what they want to do with their lives, what they want to do with their career, new social scene. So it's already, time of, I think, a lot of change, and plus that age in general. About 75% of the people who are going to be diagnosed with a mental health disorder are diagnosed by about age 24. So that early 20s age is already an age when we see sort of a lot of mental health issues coming out. But then, yeah, you look at our world, right? The people who are in college now either, sort of missed out on their high school, sort of end of high school, milestones and big graduations and things like that.
And stuff that we all who didn't have to go through the pandemic kind of reflect on is like, wow, these were milestones in our lives, but a lot of them didn't get to enjoy it. You're absolutely right.
Or if they're upperclassmen, they spent their first 2 years like, yeah, you're going off to college, and then like, it's not at all, it's sort of the college experience that I think people typically think about, right? We're getting out of it now, but they spent a couple of years with a really different college experience than maybe they expected. A lot of isolation, maybe, grieving family or friends who were lost. And also some just demographic changes with college students that, we have a lot more who maybe have caregiving responsibilities, who have more working responsibilities than sort of the, typical what you think of as college students. So there's a lot going on. And then you look at the world in general, right? More inequality, more uncertainty, with what's going on, climate change and social
countries invading other countries.
Yeah. So, there's a lot of uncertainty, and you're someone who's at the beginning of your adult life, and you're looking at that uncertainty. What does that mean for your life? And that starts to look like kind of a rational response, to be honest. So I think that's why, one really important thing, and one thing that public health can really do for this situation is addressing those lower level things on the health impact pyramid, because people feel not empowered, they feel economically uncertain and all those things, and that's they don't have that sense of community maybe that they had because of all the isolation and everything. So supporting some of those things I think are a really important thing that public health can add. In addition, right, like healthcare access is one of the social determinants of health, and I think a lot of universities and a lot of public health efforts right now are focused around, making more mental health services, on campus more easily available, changing a model so that it's not just sort of responding to students who are absolutely in crisis, and that's the only thing you can get care for, but really, backing up and supporting students who are maybe just feeling like, I don't feel great and I need a little, help figuring things out. Helping, there was recently a big lawsuit that was settled at a different university about sort of helping students more with the leave process. And if they need to take leave, a temporary leave because of mental health issues, like guiding them through that process and making it more informed, or, with any accommodations students might need, to kind of take some time or slow down or whatever because of mental health issues. So, there's sort of, again, I think if you think about that pyramid, right, there's every level, there's ways that you can sort of approach improving, mental health in general in the US and university student mental health.
Sherry, if you can go ahead and fire up, this is about a 3.5-minute video clip. It's from another institution, but I think it does a really good job of summarizing, kind of what we're dealing with at the college level in terms of students who are dealing with some sort of a mental health issue. You go to the next slide, and then it should just go ahead and click on that, and it should fire right up.
My sophomore year, we had just taken a spring break trip to New Orleans, and as soon as we got back off the bus, it was school is shutting down, pack up, head home. I'm Marissa Jones.
I'm Emma Ernst.
I'm Reed Coyle.
My name is Nidal Yasser.
And I'm a senior.
And I'm a senior.
I'm a senior
at Maryville University.
I think a lot more students have probably needed some extra support due to the pandemic.
If you think about it, we're juggling life, we're juggling friendships, and also school and work as well.
There's a whole new branch of anxiety. Not prepared for it at all.
Got me to like a depression stage, and I've never felt depressed before, and this is actually the first time I started to feel depressed, and I did not know what to do. I would come to campus, and after class I wouldn't feel like talking to anybody. It was like really hard for me, so I would just go home. My mom told me the best thing for me to do is I go to a counseling and then try it out.
I'm Jennifer Henry. I'm the director of the Counseling Center at Maryville University. Even prior to the pandemic, universities nationwide were seeing huge increases in the number of students struggling with depression and anxiety and suicidal thoughts. People forget that college students are barely adults. They think that they're doing fine, they can handle things on their own. But really, college is a time when students are expecting to branch out and be spontaneous. They're having this experience, but in such a different way.
With a lot of colleges, it's not even brought up, it's not talked about, and students have to protest or try to, bring awareness to it as much as they can, and they're still getting ignored, unfortunately.
There are some people who are having mental health issues, and they don't know how to take about it. If we don't go to counseling, at one point we will explode.
A lot of students may not need therapy specifically. They just need someone to ask them how they're doing and to express concern and help them problem solve, which is something that any of us can do.
I'm the president of Maryville Student Government. We are trying to do everything we can to educate people to say it is okay.
I do feel like, there's a cultural shift where it's starting to become more talked about, which is fantastic, and we definitely need that.
You can't take care of other people before taking care of yourself. And so I think a lot of us have learned through the pandemic that we really have to prioritize ourselves, our own mental well-being, and our education.
We're all in different boats, we're all in different stages in life, but we have to give everybody their sort of spotlight.
Might have impacted me for the better. I don't know, I'll just have to wait and see. Hopefully it's over soon.
think that was a pretty telling video from Maryville. And I don't know, Dr. Tran, do you have any suggestions if students are logged into this, if they are dealing with issues of anxiety, depression? Oh, you're muted.
I muted myself so I wouldn't make some noise in the video. Yep. Yeah, I mean, obviously reach out. I think, yeah, that one thing that resonated with me from the video was just the importance of community and of trying to build a community, and of universities, I think, supporting that and doing what they can to help students feel like they're in a supportive community, because it isn't always, you know, that you necessarily need to go to counseling. Although, yeah, I mean, you know, if you feel like that, like, it doesn't have to be maybe as bad as, I think a lot of students sometimes think it has to be really, really, really bad before they go to that level of things. I'm like, don't, you know, like just you know, call and you know, get in touch with your university's, you know, student health and get hooked up with those resources. But yeah, I mean, you know, also there's the importance, again, of that sort of context level and of you know, of trying to sort of build a supportive community and check in on your friends and be there just for those sort of things where it's more like, yeah, I just need someone to kind of hash something out with, or know that I'm not the only one who's feeling, you know, this way or whatever. So yeah, I would say, you know, again, it sort of takes all those levels. But yeah, if someone is feeling currently, you know, depressed or anxious or anything like that, reach out.
I also like the message of self-care. Take care of yourself first. And a lot of our students, especially our graduate students, it's not just them, they've got families, they might have elder care. So they've got to take care of number one first and foremost. We have a nice comment that was added by one of our first year seminar instructors and college life coaches that, you know, I have for sure noticed more students with anxiety and who are already speaking with counselors and other support systems. So that's fantastic. It is accessible here, as Molly pointed out, physically as well as virtual services. We're going to go ahead and I'm going to switch gears a little bit. Let's talk about for folks who either have the bachelor's in public health or go on and earn the master's of public health, what types of positions would they be looking at? And it's probably very expansive, but if you can, you know, maybe hone in on some locally here that, you know, our students have gotten into.
Yeah. So as you know, Tim, you've heard me say this before, the strength of public health, but the weakness of my answer is that it's a very broad field. So you heard me say all those sort of job titles that you might look into if you're trying to look into careers in public health. So things like, you know, again, biostatistics, epidemiology, environmental health, community health, environmental health already. Yeah. The nice thing about that, right, is that if you come out with a degree, particularly at the undergrad level, in one of those, you know, you go into one of those fields, right? Maybe you think you really want to, you know, go work with people all day and you go work in community health, and then you realize, maybe that sort of is a little too draining. You can switch gears a little bit, maybe do some more epidemiology, which is maybe a little bit more, you know, sitting on a computer and you know, running numbers and you know, analyzing data. If you're an outdoors person, right, environmental health, you can go dig in the mud and the muck and you know, take air samples and water samples and be outdoors all day and be doing public health that helps people, you know, really to be healthy. So, you know, if those are fields, or if you're kind of trying to look into public health job opportunities, those would be sort of the terms that you might look at. And the American Public Health Association has a website that has a lot about careers in public health if you're ever sort of just trying to dip a toe in. And even within those careers, and those job titles, you could be doing those things at a nonprofit or at you know, a university setting. You could be doing those things in you know, the what am I trying to say, governmental setting. So you know, your local Department of Health, your state Department of Health, your national things like the CDC, but also like the, you know, National Institute of Occupational and what am I saying, NIOSH and OSHA and National Institute of Mental Health and all these other sort of, you know, national level health things where you're doing health policy and you're really sort of pulling on those levers of power. So it's broad. And one nice thing to kind of help with that broadness is that both our undergrads and our undergraduate students get to do a practicum experience where it's an applied learning experience and they're out working, in a setting. And that's, been everything from, a school health type setting to a healthcare marketing kind of setting and learning how to do communications and messaging to, working with CUC. So you kind of get to, again, start to dip a toe in and actually apply that learning and figure out what it is that you like, and make those connections, which can be really nice.
I'm sorry, are you seeing demand in any particular area increase? Is it still more epidemiology, or is it some of these other aspects of public health that we're seeing an increased need for workers?
Yeah, I mean, yes, epidemiology always is going to be in demand. There's always going to be a strong demand in governmental public health and in nonprofits. I would say the biggest area of growth, and one that we see a lot of our students from Elmhurst go to, because we have a lot of connections especially from like our nursing program and with our local health system, is into more of a healthcare administration role, and working with a bigger healthcare system. Again, they're starting to realize that they're not going to keep their costs down without really attending to population health and those social determinants of health. And so that's really a great area for people who are interested in taking on a leadership position. And our master's program particularly does, we do a lot of work with leadership coursework. That's our actual focus of our program. So we do leadership coursework in some of our classes. We have them take a class that's actually specifically about sort of leading innovation within organizations. We have the option, the MBA option, right, where students can, after they complete their Master's in Public Health, they can do one extra year at Elmhurst and get their Master's in Business. So again, a lot of, sort of folks are heading into sort of that area where they can really, work within healthcare administration, work within management, leadership, and make change that way. And then I think one area, if you'll indulge me, that is really untapped is entrepreneurship. So again, with our concentration in leadership and innovation, we actually do a lot of sort of innovation and entrepreneurship work. We have a strong entrepreneurship program at Elmhurst University in general, and our entrepreneur in residence, Patrick Anahan, actually comes and speaks to my students again in the seminar class and talks about, sort of ways that, you might be a consultant, you might be, setting up your own sort of public health related business. And that's almost really untapped, but sort of limitless in what folks can do. And I really hope people will do that, because again, if you're, if you're sort of doing what we're supposed to be doing in public health and sort of pulling on those levers of power, well, those levers of power also have money to pay you. So, I think that's one area that I also sort of encourage with our innovation focus is think outside the box and start your own thing. So, yeah.
I'm going to read one of the questions that we did receive a little bit earlier in the chat. Will COVID-19 disappear magically as a miracle from God, like the original SARS virus in 2003, until the next mutation or outbreak happens again, or the next new virus, pandemic, or epidemic, or some completely new disease of origin? So I guess in a nutshell, is it just going to go away, or is it going to just be taken over by another virus? No crystal ball?
So get my crystal ball out. So there's a lot in that question. So first off, SARS in 2003 didn't magically disappear. It was people finally, sort of getting on the ball with the same kind of boring, public health measures that we've been using. We've been using to fight COVID, and we've been using since the plague. So I taught public health history last fall, and we were laughing because it's been the same things: quarantine and distancing and masking, at least since the Spanish flu outbreak. So it was really with SARS in 2003, again, it was sort of somewhat slow to mobilize the world and get the resources that we probably should have, because a lot of public health thought we were kind of past infectious disease, and a lot of those resources had kind of been, shifted to other places, shifted to those chronic diseases. But when they did finally get under control, it was testing, it was stopping travel, it was all those things that are maybe the most exciting in the world, but work. COVID, I don't have a crystal ball. We sort of keep using those effective controls until things go down just the ever slightest bit and we pop them off. And so that's really pretty much the guaranteed way to keep things going as long as possible. So I don't know, when COVID will finally end. I think we'll have more mutations, because we're kind of like the patient who keeps like taking like half their antibiotics, feeling better, and then stopping them. And that's how you get mutations down the line. And yeah, I think sorry, I hate to be the bummer. I think there will be future pandemics. I mean, really anyone from public health, who's an expert in this field that you read, it's predictable, and particularly with climate change, there may be more. Climate change, sort of changing the distribution of disease, and more travel, global travel and everything, of course, makes things spread much faster than they did back in, the plague, when people had to travel by ship. So we'll probably see it again, and hopefully, if it's again in our lifetimes, we'll hop on the ball a little faster with the, we'll be more familiar with, doing the masking, doing the distancing, and we'll know how to just kind of put it down a little quicker.
It's interesting. You mentioned, the global travel, which obviously helped the spread of COVID so rapidly. But how does the climate change affect viruses? And you mentioned that the global climate change, will probably be seeing more.
Yeah, some of that will probably be due to migration due to climate change. People, if they're living in areas where they know, it's no longer very habitable because of, sea level rise or heat or whatever, you'll get migration. That always, people carry disease. But the other is also the migration of, again, things like mosquitoes and other sort of animal, what we call vectors of disease. That's basically, they carry the disease. They don't get sick themselves, but they can carry it, and then they can spread it to humans. So like, for example, with malaria, a mosquito is the vector. The mosquito is fine, but you get bitten and then you get malaria. And, with changing weather patterns and places being warmer, or milder, than they ever were before, we'll see a change in where those, different animals and vectors live, and populations that maybe don't have any sort of immunity to these diseases are now going to be exposed, and so we'll see probably more localized epidemics, right? So that's when it's sort of widespread, but limited to more like a geographic area versus a pandemic that's the whole world, which is what COVID is. So we'll probably see a lot more sort of epidemics of things that in Chicago we might get malaria or something eventually that we would never normally think that we would get here. So yeah, it's gonna have a lot of effects.
Amazing how so many things are just interconnected, interrelated. Again, I'm going to encourage folks to go ahead and enter any questions into the chat during our remaining time here. Oh, thank you, Denise. How is public health addressing concerns about water supply? How many desalination plants do we have in the United States? I don't know if you're that knowledgeable, but if you can talk maybe more in general about water. I mean, we have the issue down in Dixmoor, Illinois. They still are under a boil order again today. So I mean, it's local.
Yeah, yeah. No, I have no idea how many desalination plants we have in the United States. Sorry. Obviously, that's a huge issue going forward, a huge issue again with climate change, and something that may end up, again, causing migration and people looking for water. Yeah, I mean.
Are there public policy? I'm sorry, any public policy that you're aware of that's moving forward?
I'm not aware of any currently addressing it at that level. I mean, water and the safety of the water supply is something, of course, that public health has worked on for ages, right? People have heard of, with Flint and addressing that, the lead in the water, in Chicago, we address a lot the, bacteria and things in our river and our lake, and that making people sick. So, I think we're very good in public health at monitoring and cleaning up water supply. And I don't know that we've done a lot. I think there's a lot of room again for people to do better health policy and really, again, get in there and pull on those levers of power to start making people more concerned about, like, let's conserve the water we have. Let's make plans, desalination or whatnot for for maintaining a water supply. I'm not super well versed on what's currently being done.
And here's where there's possibly an opportunity for more innovation and entrepreneurship as people discover new technologies and methods to create clean water. Another question just came into the chat. How does public health relate to nursing direct patient care?
Yeah, so again, I think most, right, again, it's a Venn diagram with a lot of overlap. So there are public health nurses who are actually, doing things that are outright public health, vaccination and counseling and health education, things like that are really pretty solely public health. Then there are a lot of people who are sort of doing direct patient care, like nurses, but maybe have studied or get their master's in public health, and that's really increasing because they want to be. I think especially once you get into practice and you really see, like, at least this was the case for me as well as a doctor, like I saw how limited the scope of what I could do as just a doctor was, because we would have someone come in, we'd patch them up, we'd fix them up, we'd give them their medicine, we'd sort of get them out of crisis and then send them back out and back into the exact same situation, whether that's they can't afford their meds or they can't get to the store and get their meds and get to their doctor's office to make their appointments, or whether that's they live in a neighborhood that's really struggling with gun violence and they're back for their third or fourth time with a gun violence related injury. So, I think, again, a lot of people who do direct patient care, even if that's the main thing they're going to do, often are now coming in and getting their master's in public health and getting that perspective and starting to try from that end also, right, to kind of meet us in the middle and address those social determinants of health to really be effective. So, if you're just doing direct patient care, you're mostly treating illnesses and injuries after they've happened. Public health, we're mostly trying to prevent injuries and illnesses and promote health, but there is a lot of overlap and a lot of, I think, good can come from that overlap.
So it's almost like, public health is more proactive and medical nursing is more reactive because you're already dealing with the situation, at hand.
Yeah.
Okay. My light bulb just went on, so thank you for that.
Yeah.
So the next question comes into the chat. Can you talk just briefly about our Masters of Public Health program? 2 years, part-time, 100% online, but if you want to maybe talk about some of the core aspects of the program.
Sure. So yes, our our Masters in Public Health program, as Tim said, right, it's meant to be done 2 years, part-time, fully online, and we really encourage that because a lot of our students are folks who are out working, maybe have caregiving responsibilities, and so we really try to be flexible and encourage all sorts of students to apply, and that brings a lot of, I think, richness to our program because we have a lot of people who are out there and maybe they're already working in healthcare and they're wanting to do that, switch to thinking about public health or switch to sort of management leadership position, and that brings a lot back to our classes when people can speak out of real life experience and really bring that back. The program itself, so we have basically all of your sort of standard classes that you're going to find in most public health programs. So we have your biostatistics and your epidemiology and health policy, community health and environmental health, and those are really the core disciplines of public health. I mentioned the practicum experience earlier, that you get to really do it sort of an applied learning experience right at the end of your degree program. And then with our focus on leadership and innovation, we are, as far as I know, the first public health program to actually have a concentration in leadership and innovation in public health. And that shows up, to some degree throughout our curriculum, but is really focused on in a couple of classes that are unique to our program. And that is this leadership and innovation in public health seminar that I talked about, where we have a variety of guest speakers who come in from different disciplines, and that's been as diverse as entrepreneurship and marketing. And we had someone who's a storyteller actually come in and talk about some very public health related work that he's done, data science, and we can do that because we're at this liberal arts university, that setting, where we have all these folks at our fingertips, and we can really learn from other disciplines and innovate through that transdisciplinary, taking things from other disciplines and smushing it together with our public health knowledge and creating something new. Students also in that classwork, the master's students, do a lot with leadership and learning leadership theory and things like that. They also take one class, again, something that we can do because of being at this university setting where we have all of our different disciplines. They take one class from our Master's in Innovation and Entrepreneurship program, which is a separate program at Elmhurst, but we were able to share this one class. And it's, again, about sort of leading innovation within organizations, which we want our graduates to go out and do. And then, of course, as I mentioned, the MBA option, where after they finish their master's in public health, if they want, they can take one extra year and end up with an MBA and really be sort of a powerhouse, leader, and especially if you're interested in policy or healthcare administration or anything like that, really go in that direction. I think that summarizes it. What I missed.
A bachelor's in public health. Are there other typical majors that might go into a master's in public health? Or is it pretty open?
Yeah, I think, the bachelor's programs in public health nationwide are mostly pretty new. So I would say most of the people that we get are coming from some other discipline. Okay. Obviously, I've mentioned a lot folks who are coming from, a health sciences kind of a background, medicine or nursing, or had an undergraduate degree in science, but it's not necessary at all. We definitely, and I think this comes through with our sort of transdisciplinary, we want folks to come in and bring their experiences and bring their backgrounds, but we definitely welcome students from all sorts of, different majors. There's no requirement, that you have a certain major or even that you have a science major, because I think, having a history major or a philosophy major or anything that, because public health, is so transdisciplinary by nature and affects so many different things. I think that can bring a lot of richness. And, I didn't mention this one, but we have an introductory class where we talk about what public health is, and we sort of, get you caught up on that. And so, I don't think people who are not from a science background are going to be at a disadvantage at all.
And any prerequisite courses, statistics or calculus? Yes. Okay.
Yeah, so that's our one prereq for the master's, is that students have completed, Sherry can probably get the wording right, but a college level statistics course, essentially. And we can work with you if that's the one thing holding you back. We do our statistics curriculum, especially in recognizing that we have a lot of folks who are maybe not coming straight from college. We do have the first term of statistics as sort of a really quick, so you got to keep up, but a quick review of that sort of college level statistics before we move on to the master's level statistics. So, again, we try to kind of work with people where they're at.
Excellent. I'm sure if you can go to the next slide. Again, we're going to be wrapping up here. If anybody has any final questions, please go ahead and enter those into the chat. But if anybody who's logged in today is interested in learning more about the public health program or other graduate programs we have here at Elmhurst University, you have a great opportunity coming up this Saturday morning, March 12th, 9 o'clock Central Time, via Zoom. You get a chance to meet with the program directors, perhaps meet other potential students. We have an alumni panel scheduled to take part of this. Simply just register at elmhurst.edu/choose Elmhurst. You'll get a confirmation email, and then on the day of Saturday morning, you'll receive the Zoom link that you can join us. Again, that starts at 9 o'clock, and if you stick with us for all the different sessions, including admission and financial aid presentations, you should be done by 11:30. So any other questions, folks? Now is your chance. Please enter your question into the chat. Seeing no additional questions, I'm going to thank Dr. Tran and thank you, Sherry Baccaro, for setting this up. Again, folks, if you have specific admission questions, please reach out to Sherry for public health or nursing, CSD, occupational therapy. She's our expert admission counselor for all of the healthcare programs at the graduate level here at Elmhurst University. Again, from the graduate admission office and the Department of Nursing and Health Sciences, thank you, Dr. Tran. Thank you, everybody who logged in. I do hope you were able to take some nuggets away. So have a great rest of the day, and hope we'll see some of you on Saturday morning.
Thank you.